Just
Hiya.
a minute past 12. Just give it a few more seconds before we start. Okay, all. I think we'll make a start and hope others will join if they're able. So, afternoon, everyone, and thanks for joining. As always, please keen to hear from staff across the organisation. So please do utilise chat. I'll come to Chris once I've finished a bit of an update from me. And of course, as well, people, please feel free to pop your hand up and ask questions direct. Always like it to be inclusive. So either chat or pop your hand up. So not a huge amount from me, because I'm keen really, if possible as well, to hear from yourselves. But there's a few updates. Some of this I shared with managers yesterday, but just to ensure that we're getting the communication and messaging right across the organisation. So just to touch on from a COVID perspective, and I'm sure a lot of you will be aware that we're in a much better place from a prevalence perspective than we were certainly a few weeks ago. Both community prevalence is down and also hospital admissions. There is still high requirement on urgent care, but not necessarily in relation to COVID. Interestingly, seen an increase in stroke. And there's some work underway at the moment nationally around maybe impact of COVID, etc. So, but that's certainly an area that's impacted quite significantly, certainly on our system. End of last week, seen an increase in patients presenting with strokes. So I'm sure those experts will be able to look into that in a bit more detail. So positive picture in, which I updated previously around those staff that we redeployed to support the COVID surge at Shrewsbury and Telford are back with us, and we are very grateful both to them for what they did, working in, certainly I've spoken to some staff that worked in the A&E department, totally different to what they were used to working in Robert Jones. So huge thank you and gratitude to them, and notwithstanding to staff that were here, either supporting the admin functions, moving patients' dates around, etc., working in other areas, or taking on other roles, being redeployed into other wards departments at that time. So, extremely grateful and thankful for staff for that. Just a bit I really wanted to touch on was around the IPC guidance that was issued a few weeks ago now, and more around, isn't it, how we live with COVID and how we get back really and recover services whilst living with COVID. And there was a few key changes excuse me, to that, whether it be around moving from PCR testing to lateral flow for both staff and patients, social distancing, so reducing the 2 metre distance, the wearing of face masks. I'm sure there was another area as well, but they were the key elements. Some of that quite clearly defined. So, for example, face masks in clinical areas is still very clearly within the guidance, but also gave opportunities for organisations, trusts, etc., to be able to risk assess certain areas within organisations to see what the best approach would be to enable increasing services, patient activity, but obviously ultimately protecting staff and patients at the same time. Saru unfortunately, she couldn't join today, else she would have given this update. But a lot of work with herself, other members of the IPC team, estates facilities. I know Ian from Health and Safety have been involved in this piece of work. We put out the survey around non-clinical areas and face masks, etc. So there's now a number of recommendations that are just going through our governance process, and then we'll be able to start cascading what some of that will look like as we move forward. So I'm not going to actually confirm what they are, because it just needs to make sure that the right people in the right committees are happy and cited on that, and it's signed off, and then we will, as I say, we will cascade it. So that work is imminent, so you will start to hear fairly soon what that looks like. And I know work's already started around lateral flow testing for patients. There's just some further work underway around classing lateral flow now as a medical device. So it's not as simple as just switching like we do at home twice a week to lateral flow. It's a bit more complex in our governance around that. So that's positive, and we've asked certainly Sarah and the MDs to focus on areas such as outpatients, diagnostics, therapies, etc., whereby a lot of the changes to IPC practices really impacted from a patient flow, staff experience perspective. So they're the areas that we're focusing on. And I know in my buddy visit yesterday down in outpatients, I know Ian and the IPC team have been out and about in them areas, sort of risk assessing and looking at ways and means we can support. But I suppose the key message for all this is it's done safely and it's considered. We've took engagement, you know, by doing the surveys, conversations with yourselves, that into, you know, all that's going to play out as well in what we're proposing moving forward. So that's where we're up to really from a COVID and an IPC perspective. Just on the lines of IPC, again, I've updated in various forums around the MRSA outbreak that we had on one of our wards back in the summer, and the subsequent reviews that we had and issues that were identified that we needed to take immediate action, or some of it slightly longer term. That focus is still very much our focus. And I've talked before around the seriousness and the severity of that. So we have an IPC improvement plan. Really pleased to say some already, notwithstanding there is still work to do, some significant improvements, both in our estate, some of our processes that we're undertaking. So huge amount of work and effort has gone into that. So again, extremely grateful for people involved in that. I've mentioned previously Jacqueline Barnes. She's an improvement director that's supporting the organisation in relation to the IPC improvements. And I know she's been out and about in the organisation and is supporting us in that piece of work. So again, I think we've said previously around working alongside her and teams to ensure that them improvements are put in place. Huge thank you to the estates team. I think I've called that team out previously, but I know there's been a lot of actions that we've had to take really quickly, and really grateful for your flexibility and agility in enabling some of that work to take place. And please do, if it's safe, please go and have a look at areas like, I'm sure Ludlow, they're on Clwyd Ward at the moment, finishing off works there. We've got the plaster room that I had another look at yesterday. I make sure I drop in there when I'm around in outpatients, which looks brilliant. MCSI, Kenyon Ward, most of our wards have had significant improvements, both from an IPC perspective, but also I think for, you know, staff experience working in areas that look good, both for our patients but also staff as well. So thank you to everybody involved in that. I just wanted to touch on, I think, Chris, someone's not on mute. If I can just ask people if you...
I've just muted them, Stacey.
Brilliant, thank you. Apologies, folks. Yeah, it just gets a bit distracting. Again, similar vein to just what I touched on in relation to IPC, but wanted to touch on sort of activity, patient flow, ultimately what I call patient care. Activity for me is patient care. These are patients that have been waiting far too long for reasons not necessarily within our gift to resolve due to the pandemic, and the importance really of our systems, processes, and I think more than anything, the forefront of our mind at the moment is ensuring we're getting patients through safely, but effectively through the hospital for the treatment. As I've said, they've been waiting far too long. We've touched on before the plan. So every year there's an expectation. We know this year's plan was extremely challenging and ambitious because of the backlog, because of the COVID pandemic and what all NHS trusts are facing. Certainly the first few months of this year, concentrating on patients, both from a clinical priority, because that's not gone away, but also those that have been waiting longest for treatment. There is an awful lot of scrutiny, and rightly so. I don't disagree with the scrutiny around patients that have been waiting 104 weeks for treatment. I absolutely get that, but it's a very political topic at the moment as well. So absolutely get the scrutiny, and I get the focus for all organisations. Really pleased to say that, you know, the focus at Robert Jones is absolutely there. It's not to say we're hitting the targets to have 0 by the end of June, which is only next month, but there's work underway around mutual aid to support getting some of our patients that have been waiting the longest for treatment, and notwithstanding the actions that teams have taken internally as well to try and increase the capacity we've got in some of our areas. So that focus, that plan, it's not just about the plan. A lot of focus went into doing the plan. Now the focus is around delivering it, but more importantly, treating patients that need to be treated. And then just a couple of other points that I wanted just to pick out before we open it up for any questions. People will be aware, we've been doing some work recently around CQC preparation. It is likely that we will have an inspection imminently, and some of that off the back of the fact we were due an inspection when COVID hit, and then they revised, didn't they, how they will look at risk assessing organisations as they've now started to inspect again. Also, I think with the IPC issues that we faced, again, that's put a spotlight within the organisation. So it is likely that we will have that inspection, I would say, fairly soon. We have engagement with them. They were in a couple of weeks ago where they did an informal visit. They've requested some information, and these are normally indicators that they will soon come into an organisation with their inspection regime. Please do, if you feel uncertain about certain areas around CQC inspections, please do flag that with managers, and we will support as much as possible. I know the teams have been out doing what we call sort of mock inspections, and they're not inspections per se, but they're more opportunities to gain confidence, for staff to gain confidence in what that might look like. And if you're at what you're at, you potentially could be asked by the CQC. I've always said to people in many years that I've worked in the NHS is tell them what you do. That's what they're interested in, what job you do. There's never trick questions, but again, always happy to make sure that we can support people, and there'll be more information, and we'll be cascading more preparation for staff to make sure they feel confident when that takes place. And then the other thing just to touch on, which I mentioned previously around our staff survey results, and I say that as well alongside the corridor conversation feedback, which I've now received, the themes, etc., as part of that piece of work, and what the next steps are really. And we've mentioned, and it's been out, I think, Chris, in our comms around the listening events. And I don't want people to take from that we just keep asking you either what the issues are, or this is around the listening events are very much around starting to get into, from what we've heard in the corridor conversations, from what we've heard in the staff survey feedback, but more direct really around, okay, so what do we need? What do we need to do? or, you know, by putting that's not to put ownership onto the staff, but we're really keen. I don't want us to pull together a plan that we think is fit for purpose and implement it to you. I want to make sure that the plan incorporates staff's voice within it around areas that we could do better at, what would make your working life better, and what makes you happy to work and want to come to work at Robert Jones. So it's not just another event whereby to give feedback. These are slightly different and will be positioned slightly differently to be able to, you know, really be able to say, this is what you told us and this is what we've done about it. So they will start to take place imminently. And again, we'll make sure that's communicated out. I think just touching on conversations that we've had recently around morale, which is relevant when I'm talking around our staff survey results. And I think, you know, the thing that we've been keen to really do is get more visible again in the organisation. So certainly last week was a great example of that. We had non-execs on site visiting some of the areas. Harry did his first session of you know, chat with the chairman. We had Nurses Day, which again was a great opportunity to get out and about in the organisation. So, you know, we're hearing what staff are telling us. You're keen to see senior members of the organisation and the board, and to be able to feed back on a one-to-one basis. So we are listening to that, and certainly the feedback I got yesterday when I was out in some of the areas as well in the trust was well received. So, you know, please do your feedback. We do want to hear it. And we want to take action off the back of that. So thank you. Thanks for those that have fed back. OK, Chris, can I just hand over if there's anything in the chat, or please feel free to pop your hand up if you've got a question and you're happy to ask it.
So does anybody have any questions for Stacey today? Hearing an echo on the line, my own voice coming back at me, which is never a pleasant experience. Quiet today, Stacey.
Come on, there's somebody will trigger a conversation. That's normally how it works.
So there's a comment. Oh, we've got a hand up from Mr. Kelly, Cormac Kelly. So Cormac, do you want to come in and ask your question?
Hi, Stacey. Hi, everybody. Just back from holidays. Can you just give us a little update on the whole working from home thing? And the problems we've had, visibility has been one of them, and the frustrations of trying to get hold of people. Where are they? Oh, they're working from home. They're only available on Teams. You try and get somebody on Teams, they're not available. So the whole concept, during the pandemic, we found a lot of people working very, very hard from home, and a lot of people shirking from home. And trying to get hold of some people has been a difficulty. Not to say the telephone system has been a nightmare as well, because all the numbers are out of date now. So all these contact numbers for people in the hospital seem to be out of date. So a little bit about communication, the phone line, and what's happening with that. I know there's something happening there, because that the so-called new system that was put in just after the pandemic, absolute nightmare compared to the old system. But the whole idea of working from home and getting people back in, so we can actually knock on a door and find somebody.
Yeah, it's good point, Cormac. I don't know whether I'd agree around the shirking at home. I don't think we have evidence of that, but just in relation, yeah, to we're currently undertaking a review of space, Cormac, which I commissioned Craig to undertake it alongside some of the team. And that I think is due. I think Craig's received a paper around that, which he'll be bringing to the senior leadership team next week for further discussion. We have done some work around enabling space on site. So what was the previous sort of finance floor halfway down the main corridor, that's now a hot desking facility. There is work we're undertaking at the moment around that, because once we know what space we've got, etc., we can start opening up the organisation and bringing people back. Because I agree there needs to be a balance between offering flexible working, which working from home is only one element. It's not just flexible working, but that's one element of and there are, for some roles or at certain times during the week, that's feasible. But then there are, you're absolutely right, losing that connection, isn't it? And one of the things that really came out in the staff survey was a deterioration around how people felt working within teams. That was noticeable, from a deterioration, which I'm not saying working from home was the cause, but I think potentially as well maybe one of the areas that contributed to that. So alongside the work around face masks, which I updated at the beginning, which is key as well, is there going to be an expectation if staff are working all day in offices, do they need to still remain in masks? So that is work, not work that's going to take weeks and weeks, literally within, I'm hoping, as I say, come next week, we'll be able to share more of that and start getting people back on site, notwithstanding flexibility. And for some people in certain roles, there may be a hybrid approach, or it may be relevant. In relation to the phone lines, Cormac, I've jotted that down. We can pick that up, because we need to, where we can, isn't it, make that easy for people to be able to easily access and contact people. So good points, Cormac, and absolutely on our agenda. I agree. I think the visibility is what I'm encouraging with the senior team. Yeah, elements of work can be done from home, but there's part of, I think, any manager or senior leader within the organisation, there's a role around that visibility and engagement with our workforce, which you can't necessarily do at home. So yeah, really important point. Thanks, Cormac.
Thank you for that. I think Phil Davis might have something to say as well. I see his hand up. Thank you.
Yeah, hiya, Phil.
Hi, okay, yeah, it's just a bit of a brief update on the phone system. So we are in a bit of a tricky situation now, where the phone system, we've started to upgrade it. So parts of the trust are upgraded, but a full upgrade of the phone system is due to be completed by the end of July. It's a much more modern system, which will be updating address books and those sorts of things along with it, but it introduces also a lot of flexibility. So we're beginning to engage with people to make sure that the phone we're moving them to is the right one. There's such things as soft phones now, where you can take your phone with you either on your mobile or on your laptop as you move around the trust. So say it's a modern system. It's a great opportunity for the trust, which we've invested in, and say looking forward to rolling that out with the managers and other colleagues around the trust.
Thanks, Phil. That's a really good update. Thank you. And again, I suppose we're in the middle of it, aren't we? So it's trying to be patient and bear with as we migrate, isn't it, over to that new way of working. But let's hope, it sounds like it will reap the benefits when that's fully implemented. I suppose my plea is let's pace behind it, notwithstanding July. I'm not an expert, might be totally feasible. But again, hearing some of the frustrations, it would be great to get that over the line as soon as possible. So thanks, Phil. Chris, you've got
a couple of bits in the chat now, Stacey. Sammy Davis has put a comment in about the CQC mock visits that you talked about, and she took part in those. She was saying it was great to have somebody come into the outcomes and see what they do, and she would be interested in doing more departmental visits to find out what goes on around the trust, not just for CQC. Perfect,
Sammy. I think that's a really, really good point, isn't it? There's so much more other than CQC preparation that people can get out of this. And again, I know when some of the visits, when Sarah and the team pulled that together, I think that was very much in focus around fresh eyes going into different areas. You see different things, isn't it, that when you work in an area all the time, you might not identify, but also, yeah, gives an opportunity to get to know what other people do, isn't it, and what other departments do. So yeah, thanks, Sam. It's a really good point.
And then there's comments in there as well relating to working from home, which I think you've covered and responded to. So I think people just saying, obviously there's different perspectives on that, and different reasons why sometimes people haven't been able to be on site, but I think we've covered that. Yeah, absolutely. It's not criticism of anybody that's worked from home, not at all. And again, notwithstanding that flexibility as well.
But it's also ensuring that we've done everything we can on site to enable people and teams that have to be on site, etc., are on site. So, you know, as we said, we've moved through an you know, incredibly challenging time. It's around how we move not necessarily back, but how we move forward, I'd say, is just as challenging. If anything, probably more challenging and harder. It was easier to switch things off and enact things than they are actually moving forward and switching things back on. So and hence why, yeah, you know, some things take time to, you know, debate, discuss, engage, etc. before we do that. So you know, and there's a lot at the moment. So it's around moving through all that in a logical way. So patience, please, from people. That's appreciated.
That covers the comments we've got at the minute in chat. If anybody, there's still time if people want to put their hands up and ask any more questions.
Yeah, please do. If anybody has, please feel comfortable to pop your hand up. We've always said there's not a daft question. There may be questions I can't answer that I may have to come back to you, but there's certainly never a daft question to ask. No? Okay. Mindful of people's time and lunch time, so if people can get a few minutes, that's a good thing. That's a positive. So just to wrap up, oh, seen a hand pop up. Louise.
Sorry, it's a really quick, and it's not really a question. I just don't know who to ask it of it. In the main entrance, there's no, when patients come in, there's no map anymore for them to see. It's hidden away, and none of our information leaflets or appointment letters have a map on. So it would just be really helpful if that could be put back where it used to be in the front. But again, I didn't know who I should ask it of, so I just thought it was a good opportunity.
Leave it with me, Louise. Brilliant point. Thank you. Yeah,
Thank you.
Leave it with me, and I'll get that sorted today. Definitely. Okay, I think I'll wrap up. So thank you all. Thanks for your time. Thanks for your input. Please do always feel free to, you know, pop your hand up, use the chat. It's important. This is two-way. Important for me to be able to update, but also to hear from yourselves as well. So carry on doing the great work that you're doing. There's a lot of good stuff happening in the organisation. So we've just got to keep going with that and appreciate everything everybody's doing. So thanks all and have a good day. Thank you.